So we'll start off with your opening statements, and we will start off with Mr. Blasingame. You can let me know if I'm mispronouncing that.
Hello, my name is Ross Blasingame. I'm an RN and I'm a candidate for the Hospital Board District 2. Basically, the hospital is in crisis financially. We need to take steps to allow solvency of these financial situations. And also, being a registered nurse, I would like to say that I'm an advocate for patient care and what happens out on the floor amongst everything.
Oh, your time is up.
Is it?
Yeah.
Thank you.
Okay, next will be Mr. Frank Berrigan. Oh, hold on. Don't forget to turn your mic off.
Hi, my name is Frank Berrigan. I'm running to ensure the future of the hospital in San Benito County. I'm going to give you a little bit of my background and education and work experience. I have a bachelor's degree in accounting. I've worked for the state of California for 5 years as an auditor. After that, I went and got a master's degree in business administration and a law degree with the intent to work for Fortune 500 companies and to better serve my community. If you want to put my education and work experience to work for you, vote Frank Berrigan, San Benito HealthCare District 2. Thank you.
Thank you. Ms. Sanchez? Oh, your mic.
There you go. Hi, my name is Josie Sanchez. I've been a resident of San Benito County for 48 years, married 52 years to my husband, Ron. I have 2 children, Ronald Jr. and the late Lisa Ann Sanchez. I am seeking re-election for the San Benito Hospital Board.
Thank you. Next, Ms. Mary Casillas.
Hi, I'm Mary Casillas, lifelong resident of San Benito County. I have 23 years experience in healthcare. One of my key achievements in the last 10 years is becoming a Lean Six Sigma black belt in healthcare. That means I've been focusing on the efficiencies in our hospitals that I work for. I have a master's degree in healthcare administration, and I'm a patient family advisor focusing on the patient experience.
Thank you. Mr. Nguyen?
Good evening. My name is Don Nguyen. I was born and raised here in Hollister. I've been a volunteer with the hospital for many years, and when the seat came up, my wife and I live in the 4th District, and when this seat came up, I decided it was time to step up and do that much more to help ensure the community gets the services that the hospital district is being provided.
Thank you. Reminder, there you go. And now we'll move on to Mr. Noble.
Hello, I'm Jason Noble. Over the last 30-plus years, I've been a successful local businessman and served our community on many levels. As a board member of the Holte Holiday Dinner for 19 years, the San Benito County General Plan Advisory Committee, Trespino School Board twice, president of the San Benito Association of Realtors, trustee, and then president of the Hospital Foundation, during which time we successfully performed the Maybe Skilled Nursing Facility Capital Campaign, to name just a few.
Thank you. Okay, so the first question will start off with Ms. Josie Sanchez. There's a lack of access to mental health treatment and crisis response systems for youth and adults in our county. How would you improve crisis and psychiatric response in the hospital emergency room? Oh, your mic. Your mic.
Is it on? Yeah. At the present time, the current board has submitted a proposal to Jimmy Panetta, and this is to get access for mental health for our vets. So we are trying, as soon as that it starts coming in, then we plan to integrate our youth in it, and this is the beginning, the start, the stepping stones for our mental health.
Thank you. Next will be Mr. Blasingame.
When a patient is in crisis, they need help immediately. One of the things that I would want to do is to have a crisis hotline put into the emergency room. It would be a simple matter, have a direct line, just put in a phone and advertise it. Part two of that would be to provide crisis intervention training for the registered nurses that are working in the ER. As you know, registered nurses are awesome, and they are totally capable of doing that job very well. Once the patient is been in the emergency room and has received treatment, the second portion of crisis intervention is what to do with them. You can treat and release them to home, which may turn out to be an unwanted consequence, or you can have them admitted into a facility. We could build our own facility here at the hospital. It would have to be a locked facility for a 72-hour hold, which would include patients that are a danger to themselves, dangers to others, or they are so bad off that they're unable to provide for themselves the basic things they need to stay alive: food, clothing, and staying warm. We can transfer them out. It has proven that over the past year it's very difficult to transfer a patient with 72-hour hold to other facilities. There are not a lot of facilities like that out there anyway. Thank you so much.
Thank you. Okay, next is Mr. Noble.
Yes, thank you. Mental health treatment and crisis response systems for youth and adults in our emergency rooms is a tough question. As you might imagine, we live in a county where there is insufficient funding for county programs, much less for Hazel Hawkins Hospital. As a society, we're faced with difficult questions such as these: homelessness, providing for our veterans, all difficult questions, and many of these folks are uninsured. I believe that searching for funding from within the current budget would be the first place to look. If unavailable, seeking grants or assistance from state and federal sources would be next. As a small county hospital, it may be that depending on the frequency of patient visits such as these, we may be limited to reaching out to other neighboring hospitals that are better equipped to handle and make arrangements on a referral basis.
Thank you. Mr. Nguyen?
Yes, I think at this time we have 11 specialists that are working through the district in the community. I've heard a lot of discussions with people and talking with people, not only about the emergency room from a mental health care issue, but inpatient, outpatient services that could be available also. So I do think that there is some community outreach we should have to talk to the community about where we could best serve and best place those services. I do think a hotline, the discussion of referrals, you've heard a lot of good ideas already. Because the experts are out there, it's a matter of dedicating the funds to it and doing it. Because we need to build the services that the community wants and that we can put together.
Thank you. Ms. Casillas?
I would recommend that we work together as a community. I would work with community health partners to work on this issue. I would make sure that the patients are seen and receiving their care, the right time, in the right place. And that's not the ER. Usually when they come to the ER, it's too late. I've actually seen an initiative where we get the community together and all work towards this goal of keeping the patients out of the emergency room and making sure they get the care when they need it. This was very important to the community. It actually lowered the visits for the patients coming in. We actually put case managers out in the clinics. The patients got the care when they needed it. If they needed a home, we brought in a homeless organization to help them get a home. If they needed substance abuse care, they got it there. And the caseworkers actually worked with them to make sure they got to their appointments and got the care that they need, and we saw a reduction in the emergency room. This was key and vital to the community. I would also recommend looking at something innovative like telehealth. That's when you use video services in the emergency room to get specialists in the emergency room that aren't here in our community. And I think we need to be more innovative and work together as a community.
Thank you. Next, Mr. Berrigan.
Okay. I'm going to piggyback off of what Mary Casillas was saying. about we need to have preventative care in order to solve these issues or to prevent these crises that are happening in our emergency room. We need to make sure we have these preventative cares. I've actually had many forums, and these questions have actually come about. And I actually reached out to the San Benito County Behavioral Health, and these are services that they actually currently provide. They provide in-home services. They actually have a center called the Esperanza Center, which they provide therapists for both youth and adults. They also have services for individuals and family therapy. So these services are available to us. But the thing that became more alarming to me was that these services are actually free to our community, and the county has actually reached out to our hospital to provide these services free of charge in our clinics. If I'm elected, I'm going to make sure that these 2 to 3 clinicians are in our clinics servicing our community for free. Thank you.
Thank you. Now we'll move on to the second question. As trustee of the board, you are responsible for the financial health of the hospital. Where do you, where do you think the problems lie, and what are you planning to do to improve the situation? And this one will start with Mr. Berrigan.
You look twice. All right. Well, as I stated before, I've held many forums at both Mars Hill and at Vertigo, and there's a lot of issues that have come up, which was great is we had a lot of people, a lot of nurses, a lot of community members, doctors, and health professionals show up to these forums that I held. And these financial issues not only affect the hospital, but they also affect individuals. And these are the themes that came out from these forums that I held with the community is the hospital management has not been successful in contracting with major insurances like Blue Cross and United HealthCare. Hazel Hawkins is also very expensive. That's what the community has been saying. Incorrect billing and late billing have been an issue for people here in our community. And the people in the community are also going out of town for basic services and emergency services because of these issues. In my opinion, these issues have been present for many years, and the board has neglected to address these issues. My solution is not to outsource our problems, but to actually use our own resources, our own local resources to solve these problems. Some of these solutions are we need to work diligently and collaboratively to bring back these major insurances. We need a modernized management structure. We need to get rid of antiquated billing and utilize modern day technology. We need to continue to market the true benefits of Hazel Hawkins Hospital. My education and experience in change management will be beneficial to our community and hospital board. If you want to put me to work for you, please vote Frank Berrigan, San Benito, HealthCare District 2. Thank you.
Thank you. Next, Mr. Nguyen.
Yes. Obviously, the drop in inpatient nights, the average number of people that are in the hospital overnight has dropped meaningfully over the course of the last several years. So much more is being done on an outpatient surgery format that part of the operation is profitable and doing well. But when you've got the largest cost structure being the inpatient surgery, that's a real problem. I don't know that we're really going to change that because I think the majority of a lot of these services are going to stay outpatient. The critical access designation that is being sought would have a meaningful impact to the finances of the hospital, probably in the $3 to $4 million range of additional income that we would see just due to higher payments for the services we're already providing. So I think that could be a very positive thing and has to be made to happen. The bad insurance company contracts, that's going to be a real challenge because as a district hospital, there are over 30 districts in the state of California that no longer operate hospitals because they just haven't been able to negotiate those better contracts. So saying we want to do that is a great statement. That's going to be a challenge to do that. So we also have a very unsure legislative environment. I mean, who knows what the government's going to do next and what's going to happen. So there's a lot of talk about partnerships. I think that if there are partnerships, we got to maintain local control, but I really don't think that's the answer. The answer is to reach out to the community and get the new people and existing people to use our existing facilities.
Thank you. Ms. Sanchez? Oh, here. There you go.
Mr. Nguyen has said, it's exactly what's happening right now with our insurances. And with the critical care excess, I don't know if you know what critical care excess means. That means that our government says we have to, we're 49 bed accredited for, and we have to go down to 25 beds. But that's okay, because if we should go any higher than 25 beds, if we admit more than 25 patients in the hospital, all we need to do is make a phone call and send out the paperwork that needs to be done. We also have to be 35 miles away from the closest hospital to Hazel Hawkins Hospital, and we have to be a rural community, which we are. And like Mr. Wynn said, we will be making X amount of money. But we also, in general, the hospital care change has been changing from volume-based care to value board care, which means that the board of directors need to make major changes in their objectives, strategy goals, and in spite of all these changes, the board has to continue to focus on their priority on financial and sustainability of the hospital and quality of care. Everybody has forgotten about the quality of care. We have to give quality care at the hospital. Thank you.
Thank you. Mr. Blossingame?
The financial health of the hospital is in jeopardy, and some of the things that we could do and should do is, one is to increase our business. How would we do that? Well, one way we could do it is to recruit physicians. Physicians come to Hollister and they bring their skills and they bring services with them. They admit patients to the hospital. They have procedures done. We need to bring these physicians to the hospital. We need to mend fences with doctors that have been driven out of Hollister due to bizarre politics. Physicians bring money, and then we need them. Two, we have many people in Hollister that do not even come to our hospital for services because their insurance companies will not pay if they come to us, such as Kaiser. We have 7,000 Kaiser patients, insured possible patients that could come to Hazel Hawkins Hospital, but they cannot. So we have to reach out to Kaiser. We have to work with them and keep at them until they sign a contract with us to allow those people to use our services. Recently, we lost our plan with Aetna Insurance. Those patients are not coming to the hospital now. So bring in more patients through contract negotiations with insurance providers. Bring in physicians
Thank
who
you.
bring services. And then the other thing that we need to
Excuse
do
me,
is
sorry.
we need to reduce,
Your time is up. Thank you.
thank you.
Mr. Noble?
Yes, thank you. The financial health of the hospital is a key component to our sustainability. Understanding that the hospital faces constant challenges to this goal: shortened hospital stays, unreasonable insurance reimbursement agreements, contracts with Medicare, Medi-Cal that are not honored when it comes time for them to pay us, increased expenses to the district, labor, facility needs, equipment, all on the rise. Sadly, we're a small district, and these funding sources know it. Seeking partnerships and relationships with other institutions seemed a logical next step to enter into better agreements. The critical access designation may solve our immediate problems. If it doesn't succeed, we'll be facing hard choices to be able to sustain the level of health care we now enjoy, much less seek expansion of services. As someone who's been self-employed for over 30 years successfully, I can tell you there have been times the belt has had to be tightened and we do without. I faced times like this and succeeded. I believe my experience will help us get through this if we face it again.
Thank you. Ms. Casillas?
As we've heard, the trend in healthcare is to see a reduction in inpatient numbers. With this decrease, we have to find other ways to increase our revenue. And we have to look at the patient as a whole and increase our outpatient services. That's where we really can make some money. We need to grow our services and make sure our patients are not going outside of our district to get their care. With lower inpatient numbers, we also need to look at the cost of care, the cost of providing our care. We need to improve efficiencies in the daily work of the hospital so we can save money. I have seen this many times in my organization. I have worked with many teams of frontline staff to work together to fix issues in their department. You need to talk to the staff. They know where things are broken. We need to talk to our physicians. They know where things are broken. They also know the solutions. Believe it or not, just improving the start time of the first case in the OR every morning, making sure it starts on time, saves a lot of money. We need to look at things like that. We also need to look at our billing practices. I've heard over and over again that they're broken. It makes me question, are we getting the money that is due to the hospital when it's due? Rebilling costs money, and we need to ensure we collect our co-pays, et cetera, on time. We also need to work on our managed care contracts.
Thank you. Now we'll move into closing statements. A reminder that you each have 90 seconds, and we'll start off with Mr. Noble.
Thank you all for coming out tonight. I look forward to working with the public and the people who were able to come this evening. The hospital is a landmark in our community, not only as an economic engine, but as a resource and, most importantly, a life-saving institution. If the critical access designation is unsuccessful, I want to be a part of the process which will then be needed to be facilitated. My knowledge, experience, and dedication to our community as a problem solver make me uniquely qualified as the best candidate for this position. I have self-funded my campaign and not accepted any endorsements so that I can sit before you and make this promise. If elected, any decision I make will be based upon what's best for the residents of San Benito County and the healthcare district. I have no other agenda other than what's best for Hazel Hawkins Hospital's continued success, period. Over the years, I've learned that good communication and collaboration with all stakeholders is crucial to the best decisions being made. Doctors, nurses, and patients are all stakeholders here, everyone. Please visit my website at nobleforhospitalboard2018.com or call me at 801-3210 if you have more questions. Thank you.
Thank you. Ms. Josie Sanchez?
I've neglected to tell you that I am a retired employee of 40 years at Hazel Hawkins Hospital. Past and present boards have done a great job with our hospital. Our ICU unit, our radiology, our MRI equipment in radiology, our ER expansion, our ortho clinic, our endocrinologist, our neurologist, our pulmonologists that have been brought to our hospital, specialty clinics, same-day surgery, south side, north side, women's center, and just recently, our diabetic center. And what's coming up next is our pediatric, which we need here at Hazel Hawkins Hospital, and they will be coming in February. Through each phase of this expansion, the hospital has grown despite of many challenges to serve the healthcare needs of our patients. I am very proud to have served the hospital board for the past 3.5 years, and I want to continue my public service in representing the patients and working families of our community. Everyone in this community deserves to have access to high-quality care. I am proud to be a part of the board in accomplishing these, recruiting new physicians, providing services to different locations within our community. Right now, we are in the process of bringing some insurances, as they had mentioned, that we needed. Other insurances as Aetna, Kaiser. Sometimes the boards make decisions that are not well-liked.
Thank you.
But they are decisions that are well-being for the hospital.
Thank you.
Sorry.
It's okay. Next is Mr. Berrigan. Yes, closing statement. Your mic is also not on.
Oop. Well, I had a canned closing statement, but I'm going to change that. And this afternoon, I actually went to the candidate forum at the Hollister Bar and Grill, and I want to use this time to thank my family for supporting me in running for this position here, which I think is very important to our community. I want to be able to use my experience and my education and work experience to bring a financial background to the board. Right now, I think the board does not have anyone that's financially strong. I think the administration used the financial statements to scare people into thinking that there was a financial issue, and later on they tell you, no, there's not a financial issue. I called it back in April when they had their first meeting. I pulled the financials, and I reviewed those financials. As an auditor for the state of California, we were never in a financial crisis. When you eliminate EBITDA from your financials, which is earnings before income tax, depreciation, and amortization, the hospital is making $3 to $5 million. If you want to see those financials, I have them. I have the link on my Facebook page. Please go on there and review those. I will make sure that everyone knows what the true financials of this hospital are, and I will make sure that we are financially viable and that we provide services for everyone. Thank you. Vote Frank Berrigan for San Benito HealthCare District 2. Thank you.
Thank you. Thank you. Next is Mr. Nguyen.
So, I had talked about my volunteer work on behalf of the hospital district. The San Benito Foundation Board is the volunteer board. We raise funds. I've been on that board for the past 10 years, since 2009. We've raised hundreds of thousands of dollars each year that go to the hospital for services. That's given me a great knowledge of the people involved, the stakeholders. My goal would be to take that forward. You're talking about the services that the hospital provides to the community, trying to get the existing community members as well as all the new people that are coming in to use the facilities of the district. Between the Women's Center, between the clinics, the new Diabetes Center, we have a lot to offer. I do think the community outreach to get people involved, getting people to change their medical provider is a very difficult deal, but I think that we need to continue to try to bring new people in to not transfer out for their services. The other part of the reason it's so important is the hospital district's the largest employer in the county. It's a very important deal for all the staff and all the other dependent people. So to stay viable and do all those things is not only important to us in the community to get the services, but also to the people that are there. I think that the management has improved and there is better management to staff relations now, but that needs to continue. That'll help the patient experience, et cetera. So I also have no other agenda other than to look to improve the operations of the hospital, and I ask for your vote. Thank you.
Thank you. Mary Casillas?
Thank you for your time and staying to the bitter end. When elected to the board, some of my focus will be on, number one, finding a clear strategy for the healthcare district to keep their doors open. This includes how we will make ourselves attractive for the right partner if one is needed. Number two, improving patient satisfaction, my passion. According to the latest data on healthgrades.com, the scores of patient satisfaction at the hospital are 61%, 9% below the national average, and this is not okay. Along with the satisfaction, I think we also need to look at employee satisfaction and physician satisfaction, and we need to recruit more physicians. We need to push the efficiencies like I've talked before and remove waste from the daily work of the employees at the hospital. We need to find creative ways to lower the cost of care, and this does not mean cutting labor. I will listen to my constituents, especially the elderly, to understand their needs, and I will work with administration, physicians, and staff to help find ways to meet those needs. I want to be on the hospital board because I want to give back to my community. It's how I was raised. I have the experience, the knowledge, the education, and the background to help me provide to help make positive changes to our healthcare district. I believe with what I can bring to the board, I am the best choice on November 6th.
Thank you. Thank you. Mr. Blossingen.
I've been a registered nurse for 38 years. I worked at Hazel Hawkins Hospital for 24 years in the intensive care unit and the recovery room unit. Prior to that, I wore many hats in nursing over the years. I have a family. I have 6 kids. Most of them live in Hollister. I have grandchildren that live in Hollister. My wife is in the audience over there. She's been by my side as long as I can remember. We met in college. If I was elected to the hospital board, District 2, I promise you I'll give it my best. I've worn many hats in my life, and I would like to put on one more hat and serve my community. Currently, I do work at Pinnacles National Park. I'm on the preventative search and rescue team, and my nursing experience has come in handy out there. I have been involved in a couple of rescues, and it's quite rewarding. So what I'm asking you is to please consider me for the Hazel Hospital District 2 Hospital Board. I would like to serve you one more time. Thank you.
Thank you. And a thank you to all of our candidates.